Northern Mindanao, also known as Region 10, is home to thousands of young people filled with dreams and aspirations. Yet alongside these aspirations, teenage pregnancy remains a significant social and public health issue in the region. Behind every statistic is a story, a student, a daughter, a young individual facing adult responsibilities earlier than expected. In this documentary, we explore the definition, trends, root causes, dynamics, and social and health challenges of teenage pregnancy in Region 10. Adolescence is often seen as a time for self-learning, self-discovery, and preparing for the future. Many teenagers focus on finishing their education, developing their talents, and building dreams for themselves and their families. These years are meant to be a foundation for the opportunities that lie ahead. However, when pregnancy occurs during this stage of life, it can bring unexpected responsibilities and challenges. Young people may face difficulties continuing their education, managing financial needs, and adjusting emotionally to new rules at an early age. Because of this, it is important to understand teenage pregnancy not only as a statistic, but as a social issue that reflects deeper challenges in education, health awareness, and access to support systems. By examining these factors, we can better understand the realities faced by young people in Region 10.
Teenage pregnancy refers to a situation where a girl between the age of 13 and 19 becomes pregnant. This is considered a major social and health issue because teenagers are often not yet physically, emotionally, or financially ready to raise a child. In the Philippines, teenage pregnancy has been a growing concern. According to the Philippine Statistics Authority, about 5.4% of Filipino women aged 15 to 19 have already been pregnant as of 2022. In Region 10, this situation is more alarming. Studies show that around 10.9% of girls aged 15 to 19 in this region have experienced pregnancy, making it one of the highest teenage pregnancy rate in the Philippines. Teenage pregnancy can happen due to several factors, such as lack of proper sex education, peer pressure, poverty, early relationship, and limited access to reproductive health information. It can greatly affect a young person's education, mental health, and future opportunities. Understanding teenage pregnancy is important because it helps communities, families, and schools create programs and support systems to guide teenage and prevent early pregnancy.
Teenage pregnancy is a serious issue in the Philippines. In fact, the Philippines is considered one of the countries in Southeast Asia with a high number of teenage pregnancies. According to the Philippine Statistics Authority, about 5.4% of girls aged 15 to 19 have already been pregnant in 2022. Even though this number decreases from 8.6% in 2017, it is still a major concern because teenage pregnancy can affect education, health, and the future of young mothers. When we look at the regional data, Northern Mindanao or Region 10 is one of the regions with the highest teenage pregnancy rates among the 17 regions in the Philippines. Around 10.9% of girls aged 15 to 19 in this region have already been pregnant, which is higher than the national average. The increase in teenage pregnancy in the region is linked to the factors such as poverty, limited access to reproductive health education, early relationship, and lack of proper sex education. These numbers highlight the urgent need for more awareness programs, education, and support for young girls to help prevent teenage pregnancy in the region.
Studies and reports in Region 10 show that teenage pregnancy is often linked to early romantic relationships, peer influence, and limited access to proper reproductive health education. Many teenagers begin relationships without fully understanding the responsibilities and risk involved. Because of peer pressure and the lack of guidance, some young people make decisions that lead to early pregnancy.
Teenage pregnancy is a serious issue in Region 10, Northern Mindanao in the Philippines, where many girls between the ages of 15 and 19 become pregnant at a young age. One of the main causes is poverty, which limits teenager access to education and proper information about productive health. Means not having enough money or resources to meet basic needs such as food, education, and shelter. In relation to early teenage pregnancy, in Region 10 in the Philippines, poverty can make teenagers more vulnerable to early pregnancy. When families struggle financially, especially some teenagers may stop going to school because they cannot afford expenses. Without proper education and guidance, they may lack knowledge about productive health and the consequence of early relationships. Family problems refer to conflicts or difficulties within the family, such as lack of communication, absence of parents, constant arguments, or lack of guidance. In Region 10, Northern Mindanao in the Philippines, family problems can contribute to early teenage pregnancy because teenagers who do not receive enough attention, support, or guidance from their parents may look for love, comfort, or understanding from romantic relationships. Social media influence refers to how online platforms can affect the thoughts, behavior, and decision of teenagers. In Regenta, Northern Mindanao in the Philippines, many young spend a lot of time on social media where they see posts, videos, and trends about relationships and dating. Sometimes these conflicts make early romantic relationships seem normal or exciting without showing the responsibilities and consequences. Without proper guidance from parents or teachers, teenagers may intimate what they see online, when can influence their decisions and increase the risk of early teenage pregnancy.
The teenage pregnancy has a strong impact on the dynamics of teenager lives in decision because it changes their responsibilities and priorities and future plans. First, it can affect a teenager education. Many teenagers who become pregnant may stop going to school or struggle to continue their study because they need to take care of the baby. This can limit their opportunities for higher education and better jobs in the future. Second, it affects their emotional and mental well-being. Teenagers may experience stress, fear, anxiety, or pressure from family, school, and society. They may feel unprepared for the responsibilities of being a parent at a young age. Third, teenage pregnancy also affects financial stability. Most teenagers are not financially independent, so they may depend on their parents or partners to support the child. This can create financial challenges for the family. Lastly, it influences their self-decision and future goals. Teenagers may have to change their plans, such as delaying their dreams, career goals, or personal development, because they need to focus on a rising child.
Young mothers and their babies face higher health risk because the mother's body is often still growing while also supporting a pregnancy. For the mother, there is a higher chance of pregnancy complications like high blood pressure or preeclampsia. Young mothers may also experience iron deficiency, anemia, and lack important nutrients because their body are still developing. In some cases, the pelvis may not yet be fully developed, which can make normal delivery difficult and may require surgery. For the baby, the risk includes premature birth and low birth weight. These babies may have weaker immune system or underdeveloped lungs, which can lead to health problems and may require special medical care. There are also emotional and social effects. Young mothers may feel stress, social pressure, and interruption of their educational or life plans. This can increase the risk of anxiety or postpartum depression and may affect how the mother adjusts to caring for her baby.
Teenage pregnancy is a growing social issue in northern Mindanao Region 10. Many cases are caused by lack of proper sex education, poverty, and peer influence. This problem affects not only the teenager but also their education, family, and the community. Teenage pregnancy greatly affects education. Many young mothers are forced to stop going to school. Studies that show almost 60% of early school leavers are connected to early motherhood. Because of pregnancy and childcare, students often miss classes, have difficulty completing assignments, and their academic performance declines. Without finishing school, their future job opportunities become limited. Teenage pregnancy also affects families. Having a child at a young age often creates financial pressure, especially when the parents are still studying. Some teenage mothers experience stigma, shame, or rejection, which can cause emotional pain and family conflict. Because of limited education and income, many young parents struggle continuing the cycle of poverty. Teenage pregnancy also affects the whole community. Young mothers may face health risks such as anemia or low birth weight babies, especially without proper parental care. Many teens experience fear, guilt, and social isolation. Because of this, communities are calling for better reproductive health education, awareness programs, and support service to help prevent teenage pregnancy. Understanding the causes and effects of teenage pregnancy can help communities create a safer and better future for young people.
Teenage pregnancy is a serious issue affecting many young people, including in northern Mindanao. It is often caused by early relationships, peer pressure, poverty, and lack of proper education about reproductive health. This problem can affect teenagers' education, health, and future opportunities. Young mothers and their babies may also face health risks and social challenges. To reduce teenage pregnancy, it is important to promote proper education, guidance from parents and teachers, and support from the community. By working together, we can help teenagers make responsible decisions and build a better future.